I guess they find it irritating that people are rubbing their nose on the 1 million number of cases. 1,006,000 yata yun. And after Rontgene Solante, Dr. Rontgene Solante, we will shift to something na if you are a plantito or a plantita, or you are supporting community pantries, or if you are looking for something better to do than listen to the bad news, well, we invited Assistant Director of the Bureau of Plant Industry, Mr. Glen Panganiban, para mapag-usapan yung urban farming and what many of us could possibly do for our mental health, for our physical well-being, especially by planting vegetables, etc. And maybe our excess can go to those community pantries. Okay, but before all of that, let's go to the front page of the Philippine Star. The Health Department Secretary Francisco Duque III favors an extension of the Modified Enhanced Community Quarantine or MECQ over the NCR Plus bubble. Duque said extending the MECQ for a week or 2 weeks may be needed as there was not much improvement in the health system capacity in Metro Manila and neighboring provinces. My comment on that, Mr. Secretary, whose fault is it? You're the head of the DOH. You had 1 year and 1 month to build as many hospitals as possible. Did you? No further comment. Vaccine SAR and National Task Force Chief Implementer Carlito Galvez Jr. said that 480,000 doses of Russian-made Sputnik vaccines will arrive on Thursday. Aside from that, Secretary Galvez added that these shots will arrive along with another 500,000 doses of Sinovac from China. Meanwhile, the World Health Organization's COVAX facility may be able to deliver Pfizer vaccines before the month ends. The question is, how many Pfizer vaccines or jabs will be delivered? Because if I remember what a spokesperson once said, they only ordered 2,000 laang. Hindi ko lang alam kung nagbago na po yun. Abangan ang susunod na kabanata. And speaking of vaccines, American pharmaceutical company Moderna has filed an application for emergency use authorization or EUA from the Philippine Food and Drug Administration. Moderna's vaccine has an efficacy rate of 94%. Okay, so that's good news because at the rate we're going, medyo the predominant or the dominant vaccine is Sinovac. And alam naman po ninyo na 55% lang yata ang kanyang efficacy rate. So, abangan lahat yan. Now, let's move forward to our main part of the program where we interview personalities. Before I do that, may good news lang po tayo. Vin Diesel and La Familia are back. Para naman maaliw lang kayo. I-search nyo na lang sa Facebook. Meron ako natanggap kahapon plug ng F9, Fast and Furious 9, where Vin Diesel was talking about the long absence and magkita-kita raw tayong lahat sa sinihan. Ewan ko kung sinihan, pero at least there's something to think about and muse about, okay? And let's go to our first guest for today, Dr. Rontgene Solante, a regular on agenda, one of the country's experts on infectious diseases. Munti ko na sabihin congressman eh. Doc, good morning, Doc.
Hi, Mr. Cito. Good morning. Good morning to our viewers also.
Okay, Doc. Medyo before we go into the matter or official matters such as the reporting of COVID cases, medyo pag-usapan nga muna natin yung post-hospital scenario for COVID patients. Kasi yung kaibigan ko lumabas after 4 months in the hospital, 4 months, 4 weeks in the hospital. Akala namin makakakain na siya sa labas o makaka-walking-walking na. Abay, nalaman namin na he must stay in his room, he must regularly be monitored, he must have an oxygen tank, he must be in a infection-free environment. Sabi ko, lumabas ka pa ng hospital, ganun din lang pala ang suma. What is the post-hospital scenario for moderate to severe cases, Dr. Solante?
Yeah, so may nakakita tayo ngayon sa mga pasyente, no? So sabihin ko siguro 1 out of 10 or 2 out of 10 na before they are discharged, they're not fully recovered yet, no? Pero kailangan natin silang ma-discharge kasi ang kailangan na lang nila is oxygen support sa bahay. Hindi naman pwede yun na hanggang doon pa lang sa hospital na i-wean off na natin dahil taas na ng risk ng hospital infection. No? But these are patients na talagang pinapauwi na natin and then they still have symptoms na nahirapang huminga. Pag gumagalaw, talagang merong madaling mapagod. No? And some of this, yung appetite nila, hindi bumabalik. And talagang it will take several weeks pa rin na before sila maka-fully recovered. No? Ang kadalasan dito are, tama ka, no? Yung mga na moderate to severe na matagal sa hospital. Pero ang nakikita namin ngayon, not only those, but walang pinipili na edad. Meron na rin mga bata na ganun, na medyo matagal or mabagal ang recovery nila.
Okay, now what are the concerns? Kasi alam mo, may mga napanood ako, nabasa ko na mga cases sa abroad. Akala ko naman problema lang ng mga puti, ng mga kano o baka mental health issue lang where they have no energy, they can't sleep properly. They have recurring bouts of pain or flu-like symptoms, etc. Parang sabi nila, nakauwi nga ako from the hospital, pero para naman akong early stage COVID perpetually. Ano ba itong mga long COVID cases na pinagsasabi ng mga nasa abroad?
Yeah, sa ngayon, wala pa talagang konkretong explanation kung ano ang nangyayari at ano ang cause nito, no? Ang nakita lang dito na this is a sequelae na because of the severe inflammation nung nagka-COVID sila, it involves several organs. Ang alam kasi natin muna is it will only involve the respiratory tract, no? Yung sa lungs natin. But lately, because of this mga complication, hindi lang, no? Yung puso, yung bato, okay? Tapos meron ding mental, mataas ang mental dahil yung iba talagang ang napansin nila, yung memory nila, hindi na ganoon ka-sharp at saka pag nagbabasa daw sila, yung recall nila, yung cognitive nila, ang bagal daw na hindi naman nangyayari ito sa kanila before. So these are mga long-term effect ng infection na I think attributed during the time nang tumira yung microbes sa katawan natin. It causes a lot of these changes dito sa mga vital organs natin. Hindi lang sa lungs but also to other organs, no? Ang delikado dito, Sir Cito, no, meron na rin tayong mga pasyente na na-readmit and became more, nag-develop ng pneumonia, nag-develop ng cardiac failure, no? Yung diabetes nila, masyadong mataas ang level to the point na yung kidney, bato nila, apektuhan din.
Okay. Now, nabanggit mo yung pneumonia. For the last week, all I've been talking of most of the time is magpa-vaccinate na yung mga tao sa pneumonia and anti-flu vaccine. Would this be possible with post-COVID patients? Kumbaga, tinamaan ka na ng COVID, naka-recover ka, pwede ka bang mabakunahan na for pneumonia and flu kung hindi ka pa pwedeng mabakunahan for the COVID vaccine?
Yes, pwede. In fact, sila yung unang target natin, yung unang naka-recover, especially yung nag-pneumonia, no? Dahil ang rate na yan na pwedeng magka-pneumonia uli sila, not because of COVID, but because yung ability nila sa lungs nila na hindi pa fully functional na makaprotect against any infection, pwede rin silang madapuan ng influenza or pneumococcal infection while in the community. Kaya talagang kasama yun sa discharge natin plan na when they will be following us with us sa outpatient, nirecommend din natin itong mga dalawang bakuna na para hindi maka-infection, para hindi makabalik sa hospital kaagad.
Okay, what else are you seeing with post-COVID patients? Kasi first of all, kung asymptomatic ka, do you have anything to worry? Kasi may nabasa ako dito from Team Agenda na nagsasabi, marami raw sa mga tinamaan ng COVID-19 have a higher risk for disease if not for death than the normal person. Mag-uumpisa tayo. Kung asymptomatic ka, nalaman mong asymptomatic ka, what are the risks or what are the possibilities as far as disease is concerned?
Well, for those asymptomatic, hindi masyadong komplikado ang course ng mga asymptomatic, no? Even if they have mga comorbidities, na notice natin 'yan. Parang wala kaming nakikita ditong post-COVID syndrome. Doon talaga sa mga symptomatic, no? Even with those mild symptoms, may mga post-COVID na naramdaman pa rin, no? Especially yung hindi bumabalik yung taste nila at saka yung pangamoy nila medyo matagal at saka yung palagi silang pagod na parang hindi nila maintindihan na natutulog naman sila, then they rested well, pero pag gumagalaw sila, magtatrabaho sila, parang wala talagang energy, no? Sige,
Doc
sige.
Rontgene, that reminds me of the time na nagkaroon ako ng pneumonia back in the 80s. I had a bad case of pneumonia. And it took me something like 1 month and a half to get my normal body heat back. Kumbaga lagi ako nanlalamig, summer, naka-seal skin jacket ako, yung leather jacket ba na napakakapal. And nagtataka yung mga kaopisina ko, Sito, ano mga problema mo? Ang init-init, kapal-kapal ng jacket mo. Sabi ko, nilalamig ako, hindi ko nga maintindihan. So, yun pala yung one of the symptoms or one of the problems if you get COVID-19.
Yes, no, in fact, totoo naman, no, pag meron kang bacterial pneumonia, tapos maging moderate to severe, ordinary bacteria, no, it will take 1 or 2 months fully recovered. In fact, yung iba, maulit-uli ang pneumonia because your response to that first infection may not be the same as that with another exposure. Ang nakikita natin dito sa COVID, mas longer ang recovery niya, matagal ang lag time niyan ang na-recovery. Kaya nakikita natin within 3 months, within 4 months, nandun pa rin yung latak mga manifestations na akala nila active COVID kasi outside sila sa hospital, pero nandun pa rin yung naramdaman nila. No? So this is one thing na nakikita natin na marami pa tayong hindi nalalaman sa ganitong klaseng virus.
Okay, so yung asymptomatic medyo okay lang, hindi kailangan mag-alala. Paano yung mild to moderate? Kasi may kaibigan ako, if I'm not mistaken, he's 77 yata o 67, no, 77. Malakas ang katawan nung kaibigan kong yon, and he only lost his smell, taste, and he had flu-like symptoms. Pero at his age, medyo makulit gumagala na naman. What should people like him realize?
Kailangan talaga nilang mag-ingat pa rin, no? Because even if you have mild or moderate, mataas pa rin ang risk ng reinfection. Now, ang findings natin dito, if you are in that 60, 70 years old and when you have another reinfection, baka mas malala na yung infection mo, na yung first mo mild to moderate lang, baka yung pangalawa will be more severe because tandaan mo yung age mo at saka yung previous na COVID infection mo na hindi pa masyado kang naka-recover will be the factors that will be important na pwede kang maging mas severe na ang complication mo. May mga pasyente tayo na yung puso nila hindi nakaka-recover, no? So ito yung babantayan natin, no? Yung may mga heart problems, especially for those with hypertension na, no, or mga other coronary artery disease na pag lumabas yan sila, talagang they have to follow up sa mga doktor nila para lang sila ma-closely monitor with regards to their comorbidities.
Wait, what does COVID do to patients with cardiac problems or heart ailments?
Because of the virus, it causes inflammation. No? That inflammation puts a lot of stress to our heart. So for example, yung before ka nagka-COVID, ang cardiac function mo na lang, like let's say, 60%. But when you have COVID, it will go down to even half to that, like 30 to 40%. Now, if you survive, ang ano diyan is, ang tanong diyan, will that 30 to 40% na function mo na natamaan ka ng COVID, ang malaking tanong, makaka-recover pa ba yan back to the 60%, which is very unlikely for these patients.
Okay, and that's why a lot of them suffer strokes.
Yes, stroke at saka myocardial infarction, no, yung atake sa puso.
Okay, so yung sinabi natin, mild to moderate, kung matamaan ka ulit ng COVID, malamang at malamang madali ka na or malala ang kararatnan mo. What about those na nakatikim ng severe COVID? Kasi katulad ng pastor ko na si Pastor Ricky, bata pa siya, very young, pero tinamaan siya ng severe COVID. What kind of a life is he going to have to live in the next 6 months or 1 year?
Well, depende yan sa how fast he can recover and makuha na yung normal na function ng katawan niya, no? Kasi pag sa mga severe, how fast he can recover, no? But ang pinaka-importante diyan, no, na if you are doing a lot of this exercise after or before you had COVID and after COVID you were not able to do that anymore, you can go back to that, but you have to be closely monitored and very gradual. Huwag masyado sigurong isagad mo na.
Yeah, because I remember a well-known journalist abroad, nung na-COVID siya, one of the things he shared was that his physician told him, whatever you do, make sure you are exercising or physically exerting yourself during his quarantine. So, and sabi niya, malaking bagay daw for his body and for his mind. Now, what about this breathing issue? Napag-usapan natin yan last time I interviewed you. Kasi parang yun ngayon ang nasa isip ng maraming tao. And I have to be honest, I also had that problem last week where my oxygen level went down to 91. Medyo bigla akong nagpahinga po, umupo. I sat on a chair and started doing what I remember from the swimming team na yung breathing exercises namin nung high school kami. And that really increased my oxygen level real fast in a very short time. Now, ano ba yung dapat na iniisip ng mga pasyente regarding breathing? Kasi mukhang sa mga nakakausap ko, panic sila eh. Basta biglang medyo kinakapos ng hininga, nagpapanik na sila eh.
Yeah. Dalawang effect ng COVID sa lungs natin when you recover, no? It's either you are not fully recovered or your lungs partially recovered from that, no? Tandaan natin, during the time of the pneumonia with severe inflammation, no? Kumbaga, magang-maga yung natin. Now, during the recovery din, parang sugat yan, may magkakapeklat din yan, no? Ang tawag natin dyan, fibrosis. That part of the lungs that is fibrotic is the one that will not be functional anymore at that point in time. Kaya konti lang yung nagiging functional so that oxygen level mababa, madali kang hingalin, madali kang mapagod because when you exert more effort, you need more oxygen, you breathe more. So ang payo talaga natin sa kanila is gradually you have to lessen your mga exertion or mga activities to the point lang na kung ano lang yung kaya mo. Wag mong sagarin, no? Now, if you see that you monitor the oxygen. You
Yeah.
have to do that, no? Huwag kang mag-panic kung 89 and then you are comfortable naman eh. You don't panic, just take a deep breath and rest, no? Babalik din yan. It will take time lang kasi talagang mabagal ang recovery ng lungs mo because of that inflammation. So, just monitor. Ang tatandaan mo lang na halimbawa, with room air, tapos hingal na, mahirapan ka pa rin, yun yung mga naibabalik sa hospital na talagang hindi na kaya nila, even with the oxygen at home, na dadalhin sila sa hospital.
Okay, we'll go for a quick break, Doc Rontgene, and when we come back, let's continue with this discussion, and also let's touch on the new reports of the DOH regarding COVID cases. We'll be right back. Please stay tuned. You're back here on the program agenda. I'm your host, Cito Beltran, and you are watching us via Signal TV channels 8 and 250, as well as on Facebook.com/One News, PH, and through the services of PLDT Home Fiber and Internet Unlimited. Okay, Doc Rontgene Solante, we are back. Patuloy natin yung pag-uusap natin dun sa breathing. Kasi nabanggit mo yung fibrosis na pagsusugat ng baga, the lungs are scarred because of the infection of COVID-19. How different is fibrosis from COPD or chronic obstructive pulmonary disease? Because I have COPD from my many years of smoking and I am now paying for my sins. Kinakapos din ako ng hininga. Anong kaibahan?
Well, ang nakita ko based dito sa mga pasyente natin, no, yung COPD kasi meron kang element of irreversibility. Kumbaga, hindi na babalik yun sa dati, no, because of the damage brought about by smoking. Ito naman sa COVID, nakikita natin na there's always improvement, no, pero gradual, no. And in fact, ang mga ginagawa natin ngayon sa mga pasyente, we refer them to pulmonary rehab para turuan sila yung tama paghinga at saka yung mga activities sa bahay na makakatulong na yung breathing nila hindi sila dihado at saka hopefully they will recover. So observe ko naman talagang merong reversibility, nag-i-improve sila. But in a lot of patients, it will really take time, no? To the fact, ang nakikita namin dito yung psychological na baka hindi na ito maka-recover, mataas ang risk ng anxiety at saka depression sa mga pasyente.
So wait a minute, yung breathing na yun, meron ka bang maituturo right now, Doc Rontgene? Kasi sigurado ako may gustong matuto dyan.
Yeah. So ang mga sinasabi lang namin kasi we also look at how the pulmonary rehab, mga pulmonologists do it during inpatient, no? They have this parang blow battle, no? Parang meron silang exercise nila sa lungs, they have to blow it to the point na merong aangat doon na yung aakyat yung indicator na yan to the point na yun yung sagad na yung pag-blow mo na at least mag-expand yung lungs mo. So at home, siguro just have to take a deep breath and then wag ilabas kagad ang hangin, tapos take a gradual exhale, and then deep breath, then gradual. So at that point, you will also ini-exercise mo rin yung lungs mo to expand, no? Kasi yung iba kasi natatakot na baka mangyayari yung nawalan sila ng ano. And then you can monitor when taking a deep breath and exhaling, inhaling. You can monitor the pulse oximeter. Do that siguro 10 to 15 minutes a day every morning. Hopefully, that will also help.
Okay, yung swimming ba kasi ako lagi ko sinasabi yan sa may mga hika, sa may asthma, sa mga katulad kong may COPD, etc. I always tell them, you want to improve your lung capacity, swim. Yung lalo na yung sumisisid sa swimming pool o nagsasubmerge ng ulo and doing blowing bubbles. For COPD patients ba? For post-COVID patients, pwede ba yun?
I would advise siguro they have to have recommendation from their pulmonologist, no? Kasi ang nakikita ko dyan, no, observation ko, they go swimming. Some of these patients, yung muscle, yung energy ng muscle mo may not be yet fully recovered, no? Kaya ang swimming, you also use your hands and your feet. Baka at that point in time, baka sa pag-swim mo, madisgrasya tayo because we're not just looking at breathing, also our muscles, both upper and lower extremity. So it's something we need to have clearance yet, no? Kasi pag naka-recover ka, ang notice na sa mga pasyente, talagang mabagal silang maglakad, mahina, madaling mapagod, ang gusto lang nang umupo, gusto lang nilang humiga.
Parang biglang tumanda. Sabi nga ng mga nasa probinsya, nakaw, parang tumanda biglaan. Okay, Doc Rontgene, matanong ko naman, let's go to the DOH reporting na nowadays parang binago nila yung manner and how they report, they monitor cases. What's your assessment? Do you understand it? Kasi ako, sorry, hindi ko nga maintindihan sa dami ng pamamaraan. Parang sabi ko nga why do they even bother counting the number of or the total number of cases? Parang kung gumaling, di dapat hindi na binibilang dahil dapat diminishing na lahat yun.
Well, actually, ang nakita ko lang dito, at least yung information na binibigay nila, parang in totality, alam natin kung ano ang status. Halimbawa, no? So number of cases, tapos diagnosed, confirmed in a day. Yung mga data kasi on recovered and death, these are running data. So ang ibig sabihin yan, halimbawa kung nag-report ka ng death ngayon for this day, some of the death are not really the death this day. Yung mga hindi pa na-confirm or bina-validate pa na information, tapos ihahabon nila yan for that day. So yun lang yung pagkaintindi ko, Sir Cito, no, sa mga ganitong kasi I'm not really into these numbers na nire-report nila because we were just given the numbers and we just take it that way, no? Pero I think maintindihan natin yan na ang importante dito, yung number of cases a day is dependent also on the laboratories that are giving them the data for that particular day. Pero hindi talaga yan siya na kung halimbawa 10,000 for that day. So meron kang flexibility na baka yung iba dyan na detect 3 days ago, ngayon lang na-report ng laboratory. So nahahabol yun.
Okay, but is the reporting, the data gathering reflective of the real situation? Because when I was interviewing Eki Gonzalez yesterday of the Medical City Hospital, he mentioned na kung pwede sana mas malinaw or may batayan because he said, you have a reported number of cases and then biglang a reported number of recoveries and parang pag you start comparing apples and oranges, it does not compute. Sabi nga nung robot doon sa Lost in Space, it does not compute. So, do you think that the reporting reflects the real situation on the ground, and does it help you as a head of the infectious disease?
Ang nakikita ko lang yan, ang nakakatulong yan is that we have a better understanding na kung ito yung number of cases natin, there are also those who recovered and these are the death. So yung parang ratio and proportion lang yan na mas marami pa rin nakaka-recover doon sa namamatay. And then compared to the daily number of cases, no? Kasi ang recovered yan, hindi naman din yan real time eh. Dahil when you have patients, ang average stay niyan sa hospital, no, like 7 days to 10 days. Sabihin mo, report yan after 2 weeks pa, report yan kasi binavalidate pa yung mga data. More so kung nandun sa mga mild lang sa community, ang natin alam yung sa recovery, yung mild na sa bahay, yan sa mga data natin alam, yung mga unreported na mga na-contact trace na nagpa-test lang ng antigen test pero hindi na-reflect doon sa RT-PCR. So a lot of meron pa rin talagang na mga data na hindi sa tingin ko na hindi pa rin yan as accurate as we want it to be.
Okay, what's your position on testing? Kasi alam mo, nasa probinsya ako, nandito ako sa Lipa, sa Batangas, and I've been talking to some people and sabi na, may nararamdaman ako sir, pero hindi ko kayang magpa-test, kamahal eh. Yung iba naman, nako, mapatest ka nga, pagkatapos mako-confine ka rin. What is your reaction to this situation? Should testing be for free? Will mass testing be helpful to institutions like San Lazaro Hospital, for instance?
Well, ang point kasi namin dyan, like, you only have to, yung targeted testing talaga. No? Number one, yung mga na-expose sa confirmed case, and those persons na merong mga symptoms. Kasi at this point in time, wala kasi talagang free na testing. No? Kung member ka ng PhilHealth, mas mababa ang mabayaran mo compared to doon sa wala kang PhilHealth membership. So, I think that one alone is also limiting our ability to test or do a mass testing because of the cost of the diagnostic test. No? So, sa ganun pa man, ang reminder ko talaga sa mga may mga symptoms, no? Kayo ang priority na dapat matest, at saka yung mga na-expose ng may symptom, dapat you have to have yourself quarantined until such time matest kayo. Kasi kung nalalaman natin na there are airborne transmission, asymptomatic transmission, talagang hindi natin matukontrol ang infection, especially for those who are quarantined and still continue to go out. No? May mga ganyang nangyayari, Sir Cito, na na-expose ka sa infected, pero sasabihin naman, wala pa naman akong symptom, magtatrabaho lang muna ako. And then, all of a sudden pala, you are already infected but you don't have the symptom.
Ayun. And usually, marami sa atin hindi magpapatest kasi walang pambayad o kaya wala naman ako nararamdamang malala. Yung pala ma-hospital na. Huwag kang mag-alala. Nasa mid lang ako. Nasa mid lang at medyo naalala ko yung mga testing na yan. In any case, Doc Rontgene, as always, thank you very much for your time. Marami ka pong na ituturo, na itutulong sa mga tagapakinig and even to yours truly. And I do hope that tumating na itong mga bakuna na ito para mabawasan na ang sakit ng ulo mo dyan sa ospital and for other people like you. Thank you very much, Doc Rontgene Solante.
Thank you, Sir Cito. Good evening and stay safe. Good morning and stay safe.
Okay, yan po si Doc Rontgene. Wala na sa kanyang umaga o gabi kasi perpetually on call si Doc Rontgene because of his serious responsibility as the head of the Infectious Diseases Department of San Lazaro Hospital. Okay, let's move on. Kayong mga plantito, plantita, mga supporter ng community pantries, etc., makinig po kayo in our next interview because the idea is many of us in the first year of COVID or the quarantines, many of us became plantitos or plantita, nahilig sa paghahalaman dahil hindi naman makablabas ng tahanan. Nag-rhyme yun, ha? In any case, the problem is you can only do so much. You can only do so much gardening. And after a year, you start asking yourself, dito ba? Kakantahin mo yung kanta ni Kuli Desmang, dito ba? Di ba? Dito ba ang dapat kong kalagyan? Or can there be further meaning? And it just occurred to me that instead of planting a garden for one, perhaps we can plant vegetable gardens, do this urban farming, kahit na sa probinsya, magtanim po tayo na magtanim, one to sawa, and then after that, ipamigay natin yung mga ating sobra sa mga kapitbahay, mga kakilala, dun sa mga nangangailangan. Alamin natin, let's find out from the Assistant Director of the Bureau of Plant Industry, Mr. Glen Panganiban, about all this urban farming. Sir Glen, good morning.
Morning, Sir Cito. Kumusta po kayo dyan?
Okay, pasensya na kayo kami nangangalampag kasi napag-isipan ko lang, Glenn, kasi parang napapag-usapan lagi ASF, baboy, mga kung ano, mga manok, but no one really gives enough attention to planting, urban farming, etc., etc. Ikaw Assistant Director ka ng Bureau of Plant Industry. Ano bang ma-share mo sa amin this morning?
Opo, good morning again, Sir Cito, and sa mga tagapakinig nyo, tagapanood. Ito pong urban agriculture natin, sir, ay matagal na po natin ginagawa actually. 90s pa. Bandang Quezon City, may gumagawa na dyan, sa Manila, sa Pasay. Pero sir, sabi nga po ay hindi masyadong napagtutuunan kasi same thing na sinasabi nyo, you can only do so much, mag-isa. So kami sir sa Bureau of Plant Industry, aside from dun sa pamimigay namin ng mga seeds at seedlings sa ating mga stakeholders, sa ating mga kliyente, kami po ay nag-encourage sa mga LGUs, sa mga grupo, para magkaroon ng community gardens. Before pa magka-community pantry, sir, meron na tayong mga na-establish na ganito. Kasi sir, kung mag-isa ka nga lang naman magtatanim, okay. Pero pagka nagsawa ka na, kakatanim ng mga mustasa mo at pechay, anong gagawin mo? So you can share sa kapitbahay. Actually, ganun sir ang nangyari po nung start ng pandemic, nung mga lockdowns, nung March ng 2020. Yan po yung ginawa ng mga kaibigan natin, yung mga nagsaradong farms. Sa halip sir, siyempre, wala naman silang may pansweldo na. Nagpatanim sila and then they share to their barangay, mga kabarangay, sa kanilang mga empleyado, yung mga gulay na yun, sir.
Okay, now what program does the BPI have on the ground? Kasi sorry, hindi naman ako nanlalait o nang-criticize, pero kasi maski na ako, I'm a journalist, but I find it hard to access information and more usable information regarding this urban farming or planting.
Okay. Sir, so kami sa Bureau of Plant Industry, sabi ko nga po, kami po ay namimigay na ng seeds and seedlings. So you can access that. Walk-in, meron kaming 2 opisina. Isa sa Malate, Manila, and isa sa Quezon City, sir. Isa pa nating partner sa Quezon City, sir, yung Agricultural Training Institute, Quezon City and Caloocan. So aside from that, sir, yung mga walk-in individuals, what we do is partner with LGUs, with civil society organizations, even the private sector. Kasi sir, hindi naman tayo one-on-one lagi. So we want to leverage yung power ng networks ng ating mga, even sir, mga ibang government agencies. Para sir, maka-access kayo, we are very active naman on social media, Bureau of Plant Industry. Hanapin nyo lang po, mag-message lang po doon. Or you can email kung kailangan po ng ganitong inputs, you can email our office, bpi.directorsoffice@yahoo.com. Mag-email lang or tumawag sa amin or walk-in. You can access.
Glenn, tama ba ang suspetsya ko na hindi malaki ang budget o suporta sa inyong department o sa inyong grupo? Because in terms of publicity, halos wala. Alam namin lahat yung Bureau of Plant Industry, pero in terms of this urban farming, itong pamimigay ng mga seedlings and seeds, medyo iilan lang ang nakakaalam. And also, excuse me, napansin ko lang na, alam mo, ako, katulad ako, nandito ako sa Lipa. Pupunta pa ako doon sa kung saang opisina,
Maraoy, sir.
Sa Maraoy, di ba? Magaling yung diyan OIC diyan si Vilma Vilma Dimakulangan, Now, but all over the country, one would imagine that every barangay should have a module of your department or your bureau or your office na parang may standees doon na may libreng buto, may mga pamphlets, etc. Meron ba kayong kakayahan ng ganyan o hindi nabibigyan ng lubos na pansin? Kasi baka may nanonood tayong congressman o congresswoman na plantito ay biglang masabi, ano, bakit kailangan ko pumunta sa grocery at bumili ng tigi 80 pesos na pakete ng buto, meron naman pala sa BPI?
Sir, actually, nung una po talaga, maliit na programa lang po itong urban agriculture natin. Itong tinatawag po nila ito under the High Value Development Program ng ating DA. Yung gulayan sa paaralan and gulayan sa barangay. So, maliit lang po siya. So, nung na-assign din po sa amin ni Secretary nung 2019, late 2019, early 2020, na i-revitalize itong UA, kami po naman ay binigyan ng suporta, but of course, syempre, limited ang ating kasi marami pa tayong ibang concerns. Regarding naman, sir, sa mga regions, meron din po ito. Actually, sir, malaking program naman po ito. Lahat po ng DA offices sa mga regions, dyan po sa atin sa Lipa, and other regional offices ng DA, ay meron naman po tayong program na ganito. Yung mga pag-establish ng community gardens, pakikipag-partner sa mga LGUs. Mas maganda po nga siguro if masuportahan pa tayo lalo. Kasi nga po, sir, napatunayan naman namin na talagang pag nagtanim ka, and it's very easy, meron kang aanihin. Kumbaga, very cliche yung gano'n. May tanan na may aanihin. Pero totoo, sir, kahapon lang, nakaka-harvest kami. And we shared it with the employees. We shared it with their families po.
Okay. Glenn, we'll go for a quick break. When we come back, medyo bigyan natin pansin yung bagay na yan. It's a new program, urban agriculture, but what is needed to make it, really well-known and beneficial to many. We'll be right back here on Agenda. Okay, you're back here on Agenda, and with us, Mr. Glen Panganiban. Medyo pasensya ka na, Glen. Talagang nauutal ako ngayong umaga. Assistant Director, Bureau of Plant Industry. Okay, Glen, so for starters, para doon sa mga interesadong sumali sa urban agriculture, pagtatanim sa mga syudad, sa mga urban centers, paano sila makaka-access? Meron ba kayong proseso na mag-i-email sa inyo, magte-text, tapos meron bang courier service na pwedeng ipadala? Kasi alam mo, bawal lumabas eh.
Opo. Sir, gaya nga po na sinabi ko sa inyo kanina, our office is in Malate, Manila. Kung alam po yung stasyon ng Quirino Avenue Station ng LRT, doon lang po kami sa kanto na yon.
So, pero Glenn, hindi makakapunta yung iba,
yes,
di ba?
Okay.
Kasi
Okay.
bawal.
So sir,
May
kung
courier
ano,
service
kung
ba?
may request naman sir na ganyan. Actually sir, yung courier service medyo challenging yan, ano sir. Pero ang ginagawa namin, we collaborate with the LGUs. Kung halimbawa, tight yung quarantine restrictions sa mga LGUs. Kino-contact namin yung city agriculturist nila so that they can pick up there. Sir, minsan meron kaming naka-partner yung mga bikers na sila ang nag-deliver dati. Pero sir, yung sa courier service na kami ang magpapadala sir, medyo
Alam mo,
opo,
Glenn,
challenging 'yon. Kung
alam ko
may individual sir na gustong mag-pick up, they can arrange for that. Pwede naman po sila yung mga Lala Move, nagpupunta naman po doon sa office, mga Grab na yan. Pinipick up na lang po doon sa office yung kanilang mga request.
alam mo kasi Glenn, nasa Lipa ako. Eh kung minsan may no-order ako sa Maynila, within 2 days dumarating ang halaga,
Sir.
300, 400 pesos. Eh sabi ko
Yes,
nga,
sir.
kung ikarga ito sa courier o sa PhilPost, palagay ko marami ang makikisali dito. Kasi it's not just the seeds, no? Kasi kung buto-buto lang ang pag-uusapan natin o punla, napakaliit na presyo niyan. Maliban na lang kung maramihan yung kukunin. And also, but I think more importantly are the information materials. Kasi siyempre, if the information material comes from BPI or Bureau of Plant Industry, medyo mas solid yun. Do you include those information materials?
Opo sir, doon sa mga seed packs na binibigay natin, meron naman doon sir instructions for the sowing of the seeds. Sa atin sir, sa website natin and doon sa ating social media page, we regularly post. We also have webinars sir. Almost weekly yung ginagawa namin kasi nga hindi kami makapunta sa mga lugar.
Kita mo na. Hindi ko alam na may mga webinars kayo. Paano malalaman yung schedule ng webinars, Glenn?
Sir, actually weekly siya. But what you can do, you can follow our page sa social media, sir. Medyo updated ang pag-post doon. So weekly yan. It's either dito, sir, sa central office namin, I'm talking about the BPI, or our 5 centers around the country. Meron kami sa Baguio, meron kami sa Davao, meron kami sa Los Baños, meron kami sa Guimaras and La Granja, which have their specialties.
Malaking eskaparate or modules with the instruction manuals, etc. Para doon sa nanonood ng mga congressman.
Apo. Sir, actually, binigyan naman po tayo ng funding dito sa ating bayanihan program ng ating pamahalaan, wherein nabigyan po ng funding ang ating central office and of course our DA regional offices. Meron tayong mga modules na available. Of course, ito po ay ina-assess muna doon sa ating mga partners kung yung kanilang kakayanan. Of course, tinetrain sila. Yun nga lang sir, siguro tama po kayo, yung coverage niya sa media, itong mga efforts natin ay siguro mas kailangan pa nating pag-igtingin. Kasi sir, very I think it's hindi naman po siya pang exchange doon sa rural production natin, pero yung urban agriculture sir ay talaga pong nakaka-aid, nakaka-assist sa ating finances.
Okay. Well, we will support the Bureau of Plant Industry, especially your group, Glen. Kasi, alam mo, basahin mo na lang yung column ko bukas kung saan yan ang isa sa mga suggestion ko. At lahat tayong mga ordinaryong mamamayan kailangan gumalaw na. Huwag na natin iaasa lahat sa politiko, tayo na ang gumalaw para may mangyari. Anyway, thank you very much for your time, Glenn. And please, alam mo na kung paano rin kami kontakin. Nagkakilala na tayo. Please feel free to let us know because we support the Department of Agriculture and particularly yung grupo mo na ngayon makikilala na sana sa urban agriculture. Thank you very much, Mr. Glen Panganiban.
Salamat po, Sir Cito. Salamat po.
Okay, that's Glen Panganiban, Assistant Director of the Bureau of Plant Industry. And na-mention ko po kay Glen, may column akong lalabas bukas sa Philippine Star. I encourage all of you, pakibasa na lang po. Please read it. And I am bringing to the attention of government officials na kailangan na nilang imulat yung mga mata nila because In the New Testament books, particularly Matthew chapter 13, verse 13, if I'm not mistaken, Jesus is quoted as saying, uh, seeing they do not see, hearing they do not hear, nor do they understand. Ano po ang aking hapyawan dito or tinutukoy? We have government officials who have been talking about community pantries and talking about the problem or the violations of community pantries. All they talk about are rules and regulations. But they do not hear, they do not see, they do not understand what the problem is. Kung imumulat nila yung mata nila, makikita nila yung libo-libong nagugutom, desperado, naghahanap at gumagawa ng paraan. If they open their eyes, they will discover or realize there are also many poor and rich Filipinos willing to share what they have to help others. Okay? And sadly, in all of these community pantries, you don't see government. Once in a while, dadating yung army o yung AFP, magbibigay ng gulay, but they don't have their own. And that is the problem. What we need is more of these pantries helping more Filipinos, not government officials trying to regulate and throw rules at the face of organizers. And if government itself were to lead or to get involved and come up with their own community pantries nationwide, imagine pagsamahin mo yung Department of Tourism at yung mga hoteliers na nagbibigay ng libreng pagkain doon sa mga pahirap na lugar. Imagine the Department of Agriculture and the farmers of Kalinga, Apayao, Bontoc, Laguna, etc., collecting their vegetables and sharing with Filipinos all over, not just in Metro Manila, but in urban centers na walang trabaho, etc., etc. The government has the capability, the capacity, and the responsibility to feed the poor. Pakibasa na lang po yung aking column sa Philippine Star tomorrow. And in the meantime, let's go to our netizen report para naman madinig namin yung inyong mga feedback.
Last week, we asked you if you are satisfied with the implementation of health protocols in your community. Lucky Smith says he's not satisfied. He explains there's still people who go outdoors without wearing face masks and face shields. Reynaldo Jeff Batersal has the same frustration with his neighbors in their village. Reynaldo says these people confidently go out without masks and that nobody apprehends them. He asks, where are the leaders? For May Jeray Manzano, she wishes that these violators get punished. We also discuss how the pandemic has challenged our health system in our country. That's why we ask you, what reform does the health sector need most? Christopher De Ocareza calls for the removal of incompetent leaders and replace them with real leaders who have no business agenda. Reincarnacion thinks the government must prioritize the health budget. Ayla Eduarte thinks reforms should start with the regularization of all health workers of the Department of Health. She also thinks the government should provide more effective personal protective equipment or PPEs. And Richmond J. Dancel Tumaning says we need an overhaul and that government should appoint effective, competent, and compassionate officials and personnel. Still, Richmond believes that we already have good programs in the health sector, but we don't have the right people to implement them.
Well, that's it for the Netizen Report. Thank you very much for your feedback, for sharing your thoughts, your ideas regarding those issues. And ako po, hindi magbabago yung tono ko ever since before COVID-19. I already have been lobbying, writing, talking about the government and even past administrations, the need to expand our major hospitals and build more hospitals. Yung heart center po, pataas ng pataas. Yung kidney center, ayun na, naging parang tent city na and don't fault the leadership or the administration of the National Kidney ano ba yun, and Transplant Institute. Kasi they are trying to do their job and live to their obligation and their responsibility. Yung iba dyan, bakit naman nagmukhang tent city? Kasi hindi ninyo pinush na magkaroon tayo ng karagdagang pondo para sa NKTI and other hospitals. So, sabi nga, gusto raw i-extend ng yung MECQ nung warden ng IATF. Yung si Kiko, Warden Kiko, i-extend daw yung MECQ. Kasi raw hindi pa nababawasan yung traffic sa ospital. Kung gumawa ka kasi ng maraming ospital, hindi nagka-traffic. Anyway, that's it for today. I'm your host, Cito Beltran. This is the program agenda. Thank you for joining us. Please pray for me, pray for yours truly, para medyo makakuha naman tayo ng konting pahinga. And God bless all of you. Please stay safe, stay strong, and stay healthy.